So while the rest of our participants filter in here, we will go ahead and get started with our introduction. Welcome, everyone. Thank you all for joining us once again for another webinar from the National Association of EMS Educators. If you're a returning listener, welcome back. And if you're brand new to the NAEMSE webinar series, we're very glad that you joined us today. We are proud to announce that this webinar is in collaboration with the National Registry of EMTs. Today, you will hear from Bill Seifarth, Executive Director of the National Registry, about beginning phases of developing an updated examination for AEMT and paramedic certification and what it means for program directors across the nation. Before we get started, I want to fill you all in on some of the controls that are available to you today. Attendees are in mute-only mode during today's webinar, but please interact with us if you have any questions or comments by submitting those in the Q&A panel on your Zoom screen. Feel free to type out your questions at any time, and we will read them at the end of the presentation in a moderated Q&A session. Only questions submitted through the Q&A panel will be considered. Today's webinar is being recorded and will be available on our YouTube channel and our website following the conclusion of the presentation. We are offering 1 hour of CAPCE-approved CEU for those who attend today's live webinar. To receive their certificate, I will send a link in the chat at the end of the presentation, and I will include it in tomorrow's follow-up email. If you follow that link, you'll be able to register for your CEU certificate on the NAEMSE website. NAEMSE members will receive the certificate free of charge, and it'll be $25 for non-members. I'm going to pass it over now to the National Registry. Thank you so much for joining us today, and we are looking forward to our presentation.
Thank you, Rio. Hi, everyone. My name is Emily Kirchner. I am the event coordinator with the National Registry, and I want to welcome you all to this presentation on ALS Examinations Redesign. I first want to extend a big thank you to the National Association of EMS Educators for being our partner in this webinar and for providing us this platform to spread this very important message that will affect our nation's EMS educators. So just a bit of housekeeping before we get into things. Today's webinar will run for a maximum of 90 minutes, and we welcome questions, so please submit your questions during the webinar via the Q&A function, and a video recording will be made available to all attendees. And thank you for being here. We very much appreciate your partnership. And with that, I will turn things over to the Executive Director and CEO of the National Registry, Bill Seifarth.
Thanks, Emily, and welcome everyone to the webinar. It's exciting, certainly, to share time with you and update you on some exciting happenings at the National Registry as we continue to transform, and in this case, share with you some exciting redesigning that we're doing specific with our ALS examinations for AEMT as well as paramedic. So some things are already well underway. We've made some progress, and what I want to share with you is highlights of that progress as well as the roadmap for where we're going as we redesign this exam between now and the end of next year and early 2024. So exciting stuff to share with you. Before we get into what's coming ahead, let's talk a little bit about what our current exams look like as in their current format. As you likely know, as educators for paramedic, which is on the left, the current exam for NRP, we have a portfolio and an attestation that's done with respect to the construct focused on physical skills. We have a computer adaptive test, which is largely the cognitive knowledge with respect to construct. And finally, we have a psychomotor exam or skills exam that focuses certainly on the physical skills, abilities, as well as mental skills that in particular looks at clinical judgment in the processes. In a similar way, we have the AEMT exam, which is a computer-based, it's a linear exam, but a computer-based test that focuses on the cognitive aspect, and then the psychomotor exam, which focuses in part on isolated physical skills as well as some mental skills that have focused on processes and clinical judgment. So that's where our exam currently is. And we're looking to update our exam, improve it, and essentially redesign it. And we're doing this for several reasons. One is an initiative that was approved by our board of directors in 2019 focused on strengthening the core. And part of that was how can we make sure that we are able to adopt emerging and best practices in the testing and certification industry that we can offer to the EMS community that we serve. It's also a strengthened core focused on how can we improve processes to make them more effective, more efficient, and certainly have a better user interface. So for all those reasons and more, the board adopted this Strengthening the Core initiative from 2019. And we're continuing to work forward with that. Even in the midst of the pandemic, we were making progress, not as much as we had hoped to, but we still were able to continue progressing with the ALS exam redesign. Another reason for the ALS exam redesign is focused on the integrated out-of-hospital skill that's part of the paramedic exam. That was initiated to focus on assessing a paramedic candidate's ability to work through an entire call, as well as assessing their clinical judgment. Given scenarios and given a situation, how do they act or how do they react? And so the IOH in its time, 5, 6, 7 years ago, was what we had to work with as it relates to assessing clinical judgment. Since then, though, we have, from an attesting and certification world, have advanced in that industry and can better assess clinical judgment now more objectively as well using technology. So that's what we're looking to do as part of this ALS redesign, is adopt the best practices, adopt and embrace technology, because we're enabled by technology, everything that we do here at the National Registry, which includes our assessments as well. A third reason is obviously with our dynamic and static cardiology, what we've realized that we can better assess that using technology enhanced items than we can with our current psychomotor exam, where you're given the 4 cards and you have to identify the strip and then the treatment associated with it. We can do all of that more securely and more reliably in a computer environment, a computerized environment using technology enhanced items. We also recognize the fourth point, that the logistics related to the psychomotor exam is very difficult and extremely expensive. Certainly from the candidates, from the program's perspective, from the community's perspective, it is a very, very expensive exam. And transitioning to a new way of thinking and doing will allow us to actually, in the end, save money, certainly for candidates and for program directors in particular. And we also recognize that the assessment of skills competency is actually something that can be better done over time, serially, rather than a one and done event, which is what we have with our psychomotor exam now. And that's a contributing factor to recognize that we need to think differently about this and ensure competency over several points, rather than, like I said, the one and done event, which is currently our model with our psychomotor exam. And finally, the EMS community certainly pre-pandemic expressed interest to refine the exam, to modify it, and to advance it. And so for all of these reasons, the board has chosen to undertake this ALS exam redesign. So what are the desired outcomes with respect to our new exam? We want to better assess entry-level competency, which includes more comprehensively assess that. We need to ensure that it remains psychometrically sound and is legally defensible. We also want to have a better assurance that that measure of competence is in fact true as it relates to our mission of protection of the public. So this will allow us, our proposed examination will allow us to better do that and more comprehensively do it as well. And as I stated earlier on the previous slide, we feel that this is going to better meet the needs of the EMS community. So for all the reasons there and the red boxes as referenced earlier, this is why we're doing it. And our goal is to improve and refine our examination in service to the community of EMS across our country. So what is this new exam going to look like as it relates to our current exam? The current exam, which was highlighted earlier, is grayed out. The new exam is going to assess the same constructs better, though. We will do it better than what we do it now, but we'll do it through what's referred to as a student minimum competency, which will be a prerequisite to certification. So both for a paramedic and for AEMT, there will be a student minimum competencies that have to be documented and shown that there has been progressive competency over time and that certain case numbers have been met. We worked closely with co-AMSP to develop the paramedic prerequisites, student minimum competencies, and we're working with NAEMSE and state officials to develop a similar document for the advanced EMT. With respect to the cognitive or knowledge construct, we'll continue to have the CAT and or the CBT exam. And finally, a performance component will be associated with the computer-based or computer adaptive test, wherein we will assess clinical judgment in particular, but also some of the abilities of clinical management, leadership, and communications. So another way of looking at how this exam will look, we'll have the student mental competencies, the CAT test or CBT, and then the performance component of the examination as seen here on the slide. So I talked a little bit about the importance of clinical judgment. And as I said, currently our examination focuses on clinical judgment through the integrated out-of-hospital skill as part of our psychomotor examination. And clinical judgment, what is it? It's defined there, as you can see, but really it deals with the overall clinical reasoning. It's the thought process that the EMS professional uses to evaluate and then address problems. So that's really what we're looking at from an assessment perspective as it relates to clinical judgment. How we are going to do this, we are going to use scenarios, lifelike scenarios, which will have multiple questions or multiple items as referred to them through the different phases of a call. We will use more than just multiple choice questions. We will not stick to just that. There will be a variety of different item types that we can use to assess clinical judgment. And although it is novel and new for EMS to focus this extensively on clinical judgment, it is not new for the testing and certification industry. As I said before, we are following testing and certification industry best practices. The nursing board has recently adopted this. The psychology, a couple of their exams have adopted some performance component or focus with a focus on clinical judgment. So we obviously are taking those validated models and are able to apply them to EMS and EMS scenarios. And one other thing as it relates to clinical judgment and its importance or its significance that I probably should have mentioned a couple slides ago, but it's worth mentioning here. The reason why we're placing so much emphasis on clinical judgment is in our recent practice analysis from 2019 for ALS, which is advanced EMT and paramedics. Clinical judgment was something, as well as communication, that were identified as important, as very important, and perhaps we have not appreciated their significance in previous practice analyses as much as we have recently through this advanced life support practice analysis. So our data are supportive of better and more comprehensively assessing clinical judgment, in addition to the feedback from the community and all the other input in terms of the decision to redesign our exams as talked about earlier. So clinical judgment is a very important factor as it relates to the redesign of our ALS examination as we know it today. Now, this is, if you will, a model of kind of what we're looking at with these performance components of the examination. So as I said, there will be a series of items or questions that are related to a given scenario, and it will be in different phases throughout the call, the en route, the on scene, and then the post scene. And as we're assessing this, certainly the candidates will be given dispatch information. There may be some items related to what are you thinking about as you're going en route, while you're on scene and post scene, and looking at it from a clinical judgment perspective, from a leadership and a communication perspective. And the candidates will be asked to, if you will, act or react or respond to the information they're given or the cues. How they process that information to come up with the decision or clinical judgment are based on these cues here. They'll be given and they have to recognize a cue. They have to analyze it. They can define a hypothesis, meaning in their head how they will deal with this specific situation. They will come up with a solution. Actions will be taken. They can evaluate to see if additional changes need to be considered or different steps need to be taken. But this is a model, if you will, of how one thinks as they lead into making clinical decisions. And getting back to the slide that we saw earlier, these types of models that during en route, scene, and post scene are just really indicators or models that show exactly how one is thinking as they are progressing through that. By no means this is to be interpreted as a protocol as far as how one should think, but this is actually how we as humans do think. And it's putting words to this model, which is sometimes difficult to describe, but from an exam development perspective and from the focus on the performance aspect of this, this is the thinking that's going through the candidate's head, and also how we will be assessing that thinking as they progress through a scenario. So what impact is this ALS redesign going to have on other elements of the examination? It goes without saying, but the psychomotor examination as we know it today will retire and will be replaced with our computer-based performance component of the examination, which will be part of the computer adaptive test for paramedics, part of the computer-based test for the AEMT. AEMT is about 2 hours and 15 minutes right now as far as the max length. We're looking to extend that to about 3 hours and 150 items. So not too many additional scenarios that we're expecting, but it could go up to about 3 hours and 150 items. Similarly with paramedic, it's 2 hours. Remember, it is 2 hours and 30 minutes, I'm sorry, but it has 80 to 150 items. And since it's adaptive test, it depends on how well the candidate is performing. There is going to be an extension to probably about 3.5 hours and maybe approximately 200 items. They're estimates right now. And once we get more data on how these items perform, we'll have better firm numbers in terms of what we have to extend the time limit for. So that's why they're estimates right now. They're subject to change. They have not received full or final board approval. But as we pre-test these items and as we look at how they perform in terms of how much time does it take a candidate to complete, how many items are they is necessary for them to complete to thoroughly assess the performance component of the examination. Once we get those data, we'll have some more concrete information, and certainly we'll share that with you as well as the larger EMS education community, including vendors. Additionally, with this redesign, our current portfolio requirements and COA's Appendix G requirements will be replaced by the student minimum competencies for paramedic, and it will be instituted, the student minimum competency will be instituted for advanced EMT, as stated earlier. The requirement for the psychomotor examination, like I said earlier, it will go away once the new examination element, which is the component for the performance examination, is fully instituted. However, if candidates are in the middle of the testing process of the old psychomotor examination, fear not, they will be given the opportunity to finish those testing opportunities, and that will not be a problem. And furthermore, for states that require some psychomotor examination, the National Registry will continue to make those sheets and information available for use by the states, but we will not require it, and we will not administer or have National Registry representatives continuing to administer those examinations for national certification going forward, because it will no longer be a requirement for national certification. But again, for states that do require it or programs that want to continue having that final examination, you may continue to do that on certainly your own at the program level or at the state level, and we will provide that information to the programs at that time. Now, as it pertains to a little bit of a lineup or a timeline leading up to a full implementation, to reinforce some of the points stated earlier, at the very bottom, when fully implemented, we're looking at about 3 hours and 150 items for AMT, and again, 3.5-ish hours and up to 200 items on a CAT for paramedic. That is, again, those are preliminary estimates, and we'll have information about that. We do expect the full implementation of the exam by likely, 2023, perhaps into 2024, but we are pretty confident of those timelines that it'll be at least mid to late 2023, if not into 24, till it's fully launched. And going to the very first bullet here, items that are assessing the performance components of the exam will start to appear on exams later this year in like 2022. We will be sharing prototypes as far as what those exam item types will be looking like in the very near future. In fact, we have item development already well underway with some item development panels, and they have been already independently reviewed, and we'll have more review processes coming up for the new performance component items in the very near future. But we also will be having a summit where we'll be sharing the prototypes and information with the redesigned ALS exam, with publishing companies, with testing companies that do prep, so they can see what these items look like. So all of that will be taking place this year, and information will continue to be communicated well in advance of the items showing up on any of our exams, and certainly well in advance of a full launch, which is estimated to be in 2023 or into early 2024. Now, what we've done as it relates to our examination is could not have been done, and it was not possible without the collaboration from many within the EMS industry. Certainly, we have an expert panel that has been combined and brought together to look at ways in which we can get the exam redesign into the EMS community. We had over 20 experts from the EMS industry that are continuing to work with us to make sure that the nuances related to the examination are explained, and there's ample opportunity to validate these processes, which is underway right now. We are also continuing to work with stakeholders that are interested in this, as I said earlier, with the summit and partners across the EMS industry, in particular with EMS education, to make sure that they have what they need before this is launched. So there's a lot of collaboration, communication, and partnerships that are being nurtured as we advance towards this ALS exam redesign. And co-MSP and the National Registry worked together to recreate or to create a student minimum competency for paramedic. And that will, as I said, replace the portfolio and the Appendix G requirements currently in place for paramedic. And we are working with NAEMSE, in particular with state directors that have a vested interest in high use of the AEMT to create a student minimum competencies for AEMT. So there's more collaboration going on, certainly with states, with COA, and then finally with you in the EMS educator community. We have presented the exam and the ALS exam redesign during your meeting last year, and will continue to communicate and provide updated information at any time that there have been changes. And I would encourage you to go to our website at nremt.org and to get the most up-to-date information as it relates to our redesigned exam. And feel free to visit there periodically. But if you go to nremt.org and you just, under the search feature, type in ALS redesign, our ALS exam redesign information section for our website will come up, and you can get the latest white papers, the latest information in terms of launch dates and any other data that we gather as we continue to progress towards the launch of this exam. Again, slated for late 23 into 2024. Now that actually is the bulk of the presentation that we have right now. I'm going to stop sharing my screen so that we can do Q&A. And when we've done this panel before, this is where we actually spent a bulk of our time last time, and I'm sure that we'll spend a bulk of the time here addressing any questions you might have. But I'll turn it over to Emily if you want to open up the floor for any questions. I see that there are some in there, and we'll certainly entertain those now.
Sure. Leslie Huntington asks, one of the slides show the new AEMT written exam as remaining at the CBT level. So CAT will only stay at the paramedic level for testing.
So we have CAT, or the computer adaptive test, for EMR, for EMT, and for paramedic. So we have it for 3 out of the 4. The reason why we have not moved from computer-based test to computer adaptive test for AMT is based on volumes, which that is on our plan to address with respect to redesigning our exam. It's just not going to occur at the same time that this performance component is implemented with our exam. So it is on our list of to-do items. It's just not something we're going to do right now, and it's going to remain a linear test until we get enough items, and in particular until we get enough performance component items that we have enough volume that we can transition over to an adaptive test.
Okay. Leslie Brock asks, assuming this new testing comes to fruition, when can we expect to see the launch of this new testing, and how long prior to launch will the rollout be for evaluators?
Okay, so the exam is, I think I hit this towards the end of the presentation. I assume that was asked early on, but late 2023, 2024 is when it's going to be, early 2024 is when it's going to be fully implemented and launched. There will be items that will be starting to be seen on the exam this year. And then prior to then, though, we will provide all of the item types, sample item types, and models of what this will actually look like to the EMS community, in particular publishers and others involved in the EMS education industry. Sometime this year, probably around this summer onward, you'll start to get more information. So there'll be plenty of lead time before these items show up, and certainly plenty of lead time before it's in a full effect with the full component on our exams in late 23, early 24.
Okay, Jeff Finkbeiner asks, will the new paramedic exam be adaptive? Will it distinguish between correct and incorrect responses to cues? And if so, redirect to different outcomes based on answers? So
that's an excellent question. Our initial version of this is not going to be kind of what I'm hearing you say is that like choose your own adventure, where if you get it, if you choose a wrong medication, then the scenario will be adaptive. Initially, no, but in time, yes, we will have that. What we are looking at now is a standardized approach to a call using those 3 phases: pre-arrival, on scene, and then post-scene or post-call. So all of those, all of the scenarios will be written around that model, but we will not have the adaptive nature where if you choose wrong on an item, the subsequent item, the patient will have an untoward outcome. We won't have that yet, but those technologies are out there. It's just they're not widely embraced yet in the testing certification industry. We're watching it. We're collaborating with some others in the testing industry because we do want to go that direction as we look at clinical judgment. And that's the ideal state where we're going to go to. But initially, we will not have that ability with these item types. However, we plan to do it once we have those abilities.
Leslie Brock asks, what type of additional costs can a candidate expect to incur with this?
Another good question. So as it relates to the candidate, I would say that there's probably going to be a net, it's going to be cheaper for the candidate for the simple reason the performance examination, which in most states, the candidate has to pay for, and there is huge variability and a wide range of costs associated with the exam, with the psychomotor exam that does not come to us at the National Registry. It's purely based on to administer the exam. So I would say overall there's a net decrease cost to the candidate because they will have this in one setting now. So that as they do their cognitive exam portion, as it currently is a CAT for paramedic, we will have the performance component as part of that. So there'll be actually less cost and less time to gain the certification from the candidate perspective. As it relates to the actual examination itself, we're still looking at that. I don't even have any initial estimates, but they will be fairly minor, I guess would be the best way to describe it, because the time that we're looking to add based on estimates is about a half hour for the advanced EMT and upwards of an hour at most for paramedic, and they are preliminary estimates. So I don't have any exact increase in cost. There will be an increase on the test itself for the computer adaptive, and which will have the performance as part of it. But I will say that the net effect to the candidate actually is going to be less because they do not need to pay for the psychomotor examination going forward for national certification.
Okay, thank you. And Matt Phillips asks, will NREMT be at the COA conference in June to discuss this more? And I can answer that. Yes, we will.
Yes, absolutely. And we're available at any time. You don't have to wait just to see the conferences. Like I said, go to our website, nremt.org, or feel free to email us at any time.
I'll drop that email and our phone number into the chat in a moment. Keith Melvin asks, right now, our students usually get their results in one business day. Will the redesign cause any increase in wait times for candidates before they get their results?
No, it won't. In fact, what I will say is once this is fully launched, the candidate will get the certification faster because it's going from 2 exams, psychomotor and cognitive, to now 1 exam that they sit down. So they will get the results actually faster. They won't have to wait on getting the psychomotor examination and then shipping it back to us, and we scan them, upload the results, which can take a week or 2 sometimes till those results are posted. So that will actually will be cut down significantly, and we'll still have that 24 to 48 hour turnaround period, which is going to be a lot quicker.
Michael Winnie asks, will the FIS GAP / COAMSP Eureka model filter down to the EMT level?
That's also an excellent question. One thing I will say about the student minimum competencies, which I think you're referring to, is we're heavily driving this based on the ALS practice analysis. And what we did in 2019 is we split ALS from BLS because we recognize there's differences between the both in terms of the actual field practice. And we're in the process right now of doing our BLS practice analysis this year. And we're looking at EMT and EMR much different than we ever had before because the profession has changed pretty considerably. So the initial findings are that, communications in particular have been perhaps underappreciated or understated on previous practice analyses based on the formats that we did. Now that this model we're approaching, it is likely that we will see some of these item types on future BLS exams, but nothing has been discussed yet. The practice analysis is not done, so I can't give a timeline. I would say that the soonest that the conversation would start about this would be late 23, early 24, once we're done the BLS practice analysis, which is slated to be done this year. So we'll have more information next year, but in terms of what we do with that information and how it'll impact the exam, it's at least a year out afterwards till we start to see any changes or consider changes with the EMT or EMR exam.
Daniel Bernard asks, does the SMC have to be implemented in progress or completed for cohorts prior to the new exam format?
So the student minimum competencies, which will be a requirement for, it's a prerequisite for us, so it'll have to be done and instituted through COA-MSP for paramedic. That actually is, I think COA has put a start date of that January 1 of 2023 or 24. I'm not sure exactly which one, but they did announce earlier this year when that will be going into effect. So I would refer you to COA-MSP to see the actual required start date of that. But we will, once we fully launch in late 23, early 2024, we will have the requirement in place for the student minimum competencies. And also this undoubtedly will be a follow-up question. For those that started testing under the old model, as I stated earlier, they can continue to test under the old model. They won't be required to start all over again. So rest assured with that. Going forward.
Ksenia Gale asks, when should we expect release of the new competencies for AEMT and paramedic programs?
As the competencies as it relates to the student minimum competencies, or are you talking, which one are you talking about? The student minimum competencies, COA has already released that. That was done a couple months ago. So that has been released and is out there.
I'll see if she puts anything into the chat.
And I'm also going to put in there where our ALS Redesign site is. You can go directly to that in our chat. I just put that in there now.
Okay. And Todd Vreeland asks, when will both practice analyses be available?
The ALS practice analysis is currently available. The BLS is underway right now. As I said, we're redoing it, and it should be done this year and approved and reviewed by our board next year. So sometime next year for the BLS, the updated BLS. But the ALS high-level practice analysis is actually available on our website.
Well, that answers all the questions in the Q&A, but I think a few people put them into the chat. So I'm going to scroll through here.
Okay.
Well, not a question, but Brian Webb says, for Alaska, I am pleased to have been on the paramedic cognitive writing team, as well as started on the AEMT PE team yesterday, making a difference.
Good. Good. I'm glad to hear that. And it's awesome to see your positive interactions. That's very encouraging.
And you may have answered this already, but Ksenia Gale asks, will AEMT test become adaptive?
We plan to. It's just the redesign is going to take precedence. And once we get enough volume, especially as it relates to the performance component items, we can transition on over to adaptive. It's just the volumes are so much lower for AEMT than they are for paramedic. It's harder to do.
Edward Back asks, prior to implementation, will there be a program available to prepare students for new registry scenario-based CAT exam?
Yeah, so that's, we're going to have, I stated earlier, we're going to have a summit with vendors, certainly EMS education, publishing companies and other vendors, so that they can start to adapt and adopt resources for exam prep. Obviously, we at the registry will happily provide some prototypes, and so that candidates can kind of get a look and feel for what the exam items will be looking like. And we'll be providing that very soon in the next few months, again, well in advance of any of those items appearing on actual live forms, and well in advance of them being fully implemented, which will be in late 2023, early 2024.
Ryan Dennert asks, will a state-approved psychomotor exam still be required for EMT?
Yes, that will. The impacts we talked about are limited to the advanced EMT and paramedic ALS exam redesign. Obviously, BLS, which is EMR and EMT, will continue to have the same requirements of the psychomotor examination and cognitive exam. Once we update the practice analysis for BLS, which is underway right now, we will have better facts and understanding of what we need to do to potentially consider redesigning BLS examination going forward. But the first step is to do the advanced EMT and paramedic. With the practice analysis for BLS underway now, we should have better information next year, early next year to middle of next year, as far as what we want to consider for the BLS redesign.
Okay. Heather Davis asks, Bill, can you please define performance exam and performance-based exam as IO psych terms or psychometric terms? I think some are hearing performance exam and still thinking the scenarios you are talking about are going to be live because they're asking about evaluator training. I'm pretty sure the intention is for all scenarios to be on the computer.
Yes, good point. So a couple things. The psychomotor examination as we know it today, which includes the IOH skill, is going to be retiring. So there will no longer be a scenario, a live scenario, if you will, but there will be computer-based performance component items. So we'll be assessing clinical judgment on the computer. It will be at one sitting, one setting. The examination will be a one-seated event. You will not work through any scenarios like you do with IOH right now as part of the psychomotor examination. It will all be computer-based, and it will focus heavily on, as we stated earlier, clinical judgment. So yeah, there won't be any, and I get what I think she's saying about some of the evaluator training. We won't have evaluators who will be administering the scenarios. They will all be computerized examinations that will take place at the Pearson testing centers as they do right now for the CAT test. The performance component of the examination, which is a focus on clinical judgment, will be part of that sitting or opportunity when they sit to take the examination. So it'll be a one event instead of two separate events, and there will be all computer-based going forward once this is put in place.
Jeff Finkbeiner asks, can you elaborate on how you expect to assess psychomotor skills like intubation and venous cannulation with your new redesign?
Sure. So the student minimum competencies, which was talked about, has a series of skills that candidates have to demonstrate over time. So we're going from a one and done event, which is a 1 day psychomotor examination, which can take upwards of 8 to 10 hours, 10 hours to administer, where a series of skills are assessed, to the student minimum competencies, where it's documented over time throughout the course of the paramedic education program. So we will have a serial assessment of the examinations, hopefully showing progressive proficiency and competency over time rather than a one and done event. So we'll be relying on the student minimum competencies, which will then be a prerequisite for national certification as an AEMT or as a paramedic.
Keith Melvin asks, do you feel a program starting this fall would be able to utilize the new testing by May 2023 graduation?
I think it will be pushing it for May 2023, to be honest with you, because I think that, remember, we have to go through a pretty comprehensive psychometric process to get enough data on the items to see how well they perform, and to make sure that they're measuring what we want them to measure, which there's a lot of psychometrics that go behind, that are happening behind the scenes to validate all that. I don't think we're going to have everything wrapped up and in place by May 2023. I can almost absolutely assure you we will not. So that's why we're saying late 23, early 2024 will be the time period when we will fully launch the exam with the performance component items on them. However, if they're testing in May of 2023, odds are they're going to see some performance items on the exam, which they'll be tested on, but it will not be as big as they will be once we fully launch in 23 and late 23, early 2024.
Richard Nichols asks, will we as educators be able to view or try these new computer evaluations?
Absolutely. And as I stated a little bit ago, we're going to make sure that we make them available, certainly not just to the educator community, but also to some will be available on our website. So that look and feel from the candidate perspective, the educator's perspective. We are also having a summit meeting with publishing companies, with test publishing companies that are in the EMS space. So all will be made available, and certainly the EMS educators through many venues can have access to them, again, well in advance before we launch the actual exam, or any of the prototypes coming up will be available to the community well before they're actually on the assessments themselves.
Daniel Bernard asks, RRT has a 2-tier exam, knowledge followed by clinical, assuming they are successful at first. Given the extended 3.5-hour time frame, is there any conversation regarding a split exam rather than a single exam of great length and a high number of questions?
Another great question. The short answer is yes. We are looking at several different things as it relates to how long the exam is, and in short, we're going to have a break. We're going to need a break in there, because if it's 3.5 hours long, we need to make sure that there's ample opportunity for people to get up, give their brain a break, have a bio break, and then be able to continue with the examination. So that is definitely something that we're considering. You mentioned the RRT exam, but there's other exams too that are of equal length to ours, if not longer, and they have planned in breaks there. Once we get more data in terms of how long the items take to complete, how well they perform, we'll then be able to say, all right, so probably about this point in the exam, we would give a break. As it relates to the overall outcome, it is a successful completion of the exam. It will be one exam. So we will not separate the performance component from the cognitive component. It will be a one exam that you have to be able to meet a passing standard. And that passing standard is not set by us at the National Registry, but rather we bring in representatives from across the community, including EMS educators, EMS clinicians, medical directors, state officials, fire-based, non-fire-based systems, employers. All of those are involved in what we refer to as a standard setting process to say what is required or expected of a minimally entry-level competent EMS clinician, whether it be a paramedic or an AEMT. And so those passing standards will be decided through the standard setting process, and we will use that standard setting process for the new examination once fully launched in 23 or early 2024. But it'll be one exam, and they have to achieve competency on the overall examination itself, which includes the performance component items on the exam, in addition to the current domains that are tested for the computer adaptive or computer-based test as it relates to AEMT.
Matt Phillips asks, if a cohort starts under the old testing requirements and the transition happens, they will not have to take the new test, correct?
If they start testing before the new exam, they finish testing under the old system. If they start testing when the new exam is officially fully launched, they'll have to meet the new requirements. And there will be a period of transition, which we recognize some that still have to finish their testing process, and they'll be able to continue doing so until they've exhausted their testing opportunities, or as we prefer, once they obtain national certification, then it's done. So if they start under the old, they'll finish the old. If they start under the new, it's just the new.
Megan Corey asks, how will you work with physician medical directors of accredited paramedic programs who are required to approve all high stakes exams in their programs to ensure their involvement and input?
So like the EMS educator community, we'll continue to work with the physician community through our efforts at NAEMSE. I will say that at the National Association of EMS Physicians Conference earlier this year in January, we presented there about the ALS exam update, as well as other happenings here at the National Registry. So we'll continue to work with NAEMSE and the physician community to make sure that they are prepared for this evolved, better, and awesome redesigned ALS exam, just like we're doing certainly with the EMS educator community.
Mitchell Reuter asks, beyond saying that this test style is used by other professions, is there literature either in educational psychology or good quantitative metrics showing improvement in patient care that shows primary computer-based exams will benefit patient care?
So a lot with that question, and I'll start with, if you go to our website, and I put a link actually in the chat, there are a series of documents that are in there, including one on the clinical judgment model that actually shows some reference to its effectiveness, to its validity of essentially assessing what it says it assesses, which is clinical judgment. Now, in terms of empirical evidence or quantified research to show that this is superior to other models, I don't know if there's anything out there that specifically states that, but I will refer you to the one white paper that is on our site. It's the clinical judgment model. And we have a series of other white papers that will be published in the coming months, all of which are being published, but will be available at least via a link on our website that you can refer to in terms of further evidence. Part of the reason why it's going to take us so long to get this fully launched, which is late next year, early 2024, is that we're doing a series of additional, validation studies to make sure that we're measuring it appropriately, that it is measuring what it's intended to measure. So a lot of those studies are underway, and the initial reviews of them are underway as we speak, and will continue, and we'll publish more information up there. But I do refer to the website. Go down and look for I'm just looking at it now under February 2022, the clinical judgment model. There's a PDF on there, And I believe that has information on there, as well as a clinical judgment framework and performance component under resources at the bottom of our ALS Redesign section of our website.
Edward Back asks, for program directors, when approving students for registry testing, will there be just one area to approve, have psychomotor and cognition? And also, will EMT and EMR remain the same?
So EMT and EMR for now, yes, staying the same. We're doing the practice analysis for BLS this year. We'll have more information probably next year as far as what, if any, impacts we're going to see for EMT and EMR. And what was the first part of the question? I totally drawn a blank now.
For program directors, when approving students for registry testing, will there be just one area to approve?
Yeah, so there'll be exactly what this is going to look like on our website. We have some ideas yet. We don't have any firm understanding, but I will say that there'll be an attestation as it relates to the student minimum competencies, which is the new document that I said we created with COA for paramedic and working with NAEMSE and states to create for AEMT. So once those the paramedic student minimum competencies are already out there, and once the AEMT student minimum competencies are finalized and approved by our board, that will be distributed and made widely available for everyone to view. But there will be a sign off similar to what we have right now from the program director to attest that they have successfully completed the student minimum competencies document, and B, that they've completed a state approved course or a COA accredited or KHEP accredited program. So all those requirements will remain similar, but we're going to have more of an attestation right now as it relates to the student minimum competencies that will be signed up by the program directors. And more clarity on that as far as what that looks like and how there'll be some validations of that will be forthcoming once we have some better understanding of how this will fit in the bigger picture. But it will look pretty similar to what we have right now is what we're anticipating at this point.
Eric Epskin asks, what challenges have you identified for those requiring ADA type accommodations?
So we haven't really seen, I'd say, any challenges as it relates to ADA because we have a pretty very, I'd say, advanced ADA policies as well as how we handle ADA requests here. So we anticipate that will continue. I will say that from unrelated, but the volume of requests for accommodations have increased pretty significantly, and our ability to handle them and turn around a decision is pretty quick. So I anticipate that's going to continue. I really don't see any changes or challenges as it relates to ADA with respect to the advent or addition of the performance component items on the examination going forward.
Bill Doyle asks, hi, Bill, will you be providing a status update at the August NAEMSE Symposium in Louisville?
Absolutely. Yep. Any opportunity we have to talk about ALS exam redesign or continued competency or any other initiative ongoing here at the registry, we'll take full advantage of it. We're planning to present at multiple conferences coming up nationally as well as regionally and locally. And the short answer is yes, we will be happily providing updates to everyone every opportunity we get.
Thank you. And I just dropped the link to our page, the page on our site on ADA accommodations into the chat for anyone that's interested.
Good. Yeah, this process is, I think, thoroughly outlined on our website for requests for accommodations and how that is handled. So feel free to go to that site should you have any questions regarding it.
Leslie Huntington asks, since this is moving away from portfolio and Appendix G, could you describe the process of verifying schools have brought students to competency? Sorry.
Mm-hmm. So I think maybe it was maybe some typos in there, but I think maybe what she's getting at is how are the schools going to verify the competencies from how they do it now, which is through our psychomotor exam, as well as through the portfolio and Appendix G into student minimum competencies. Simply put, the Appendix G and the portfolio as we know it today were updated and combined to be essentially those two documents retired, combined, and we have the student minimum competencies. But the student minimum competencies are in part based on data from the ALS practice analysis. And just as programs are required to attest that the student has successfully completed the course, they'll continue to do that just as they have in the past. But the numbers and some of the requirements outlined in the student minimum competencies have been updated based on actual frequencies and numbers that are come from NAEMSE, essentially, in terms of the call distribution and the skills that are performed. So the data from the practice analysis went in to form the student minimum competencies, and the programs, just as they are currently required to sign off as far as the student successfully completed program, will have to do that, but there'll be perhaps some additional language specific to the student minimum competencies as they're being updated on the redesigned exam.
Daniel Bernard asks, any discussion of offering the exam in Spanish or other language?
No, there's been no discussion for language other than English, and have not had the board has not entertained that as a topic. So the short answer is no. English is the only language now for our exams.
Sean Pochik asks, is the number of attempts for students who are not successful on the first attempt, does that remain the same?
Right now, it is remaining the same. We are looking at some options that we can explore in terms of, retesting options and what number and how one will go about the retesting process. As it stands right now, though, the number of attempts and the required time periods in between the attempts have unchanged. And if they do change and the board decides to adopt and evolve with that, we certainly will be sharing all that information very soon once it's available.
Sherry Albo asks, as an EMT, I am ready to get my nationally registered AEMT. Do I simply email or call to get into a class?
Yeah, you have to look locally at one of your programs that might be available that's offering that. Obviously, from the national perspective, once you complete the state-approved advanced EMT course, then you'll be eligible to sit for our examination. So start with perhaps your local EMS agency and or state office to find out where your local programs are.
Edward Back asks, for states who are not satisfied with the removal of the psychomotor exam, what are their options with the registry?
The short answer is they can continue to administer a psychomotor examination or require that to be administered by the programs. And we are aware there are a handful of states that have it pretty hard baked into their regulations that there be a psychomotor examination, and they can continue to do that. That is not a requirement that's going away. We will continue to support states, especially in this transition, and they will be able to continue doing that if they so choose to do so. It will, however, it will not be a requirement for national certification once we fully launch the performance examination slated for late 23, early 24.
George Amolo asks, is NREMT examination open to international citizens, or is it still just US-based exams?
So it is, the examination is based on the US standards and is based on the practice analysis that was conducted here in the United States. So it is US centric, and international candidates can, however, if they are interested in coming into the United States and gaining national certification, can work with, for paramedics, accredited paramedic programs, and be able to obtain the requisite gap knowledge and a gap education, so they would be then eligible to sit for the examination. And that actually is through the advanced placement process, which does exist currently. So international candidates would be eligible to sit for our examination once they work through in this case, an advanced placement process with an established paramedic program in the United States.
Leslie Brock asks, what influence will this have to prompt publishers to update teaching material to meet new NREMT testing standards?
Well, there's a couple thoughts here, I guess, philosophically speaking, that if education programs educate students to be functioning at entry level, which includes focus on, clinical judgment and appropriate skill, competency, and the knowledge, if they prepare their students to be entry level competent, then there really won't necessarily be a specific change in terms of what the publishing companies will provide to prepare the students to take the examination, because our exams are based on practice analysis of what is actually happening in the pre-hospital environment. And as a result, if the students are prepared to function there, then they will have no difficulties in terms of the test itself related to what we're testing or how we're testing. I also will say that from a publishing company, in terms of the look and feel, as well as test prep items, we do, as I referenced earlier, have a summit coming up that we'll be working with those in the EMS education industry to prepare them to take the new performance component items, as well as to make sure that they have an understanding of what that's going to look like, and that they're not just having to, the first exposure they have to those types of items or questions will be during the exam itself. So we're going to make sure there's a lot of proactive and advanced communication and coordination with the educator community and publishing companies. But I end with the point that I started with, that if the education programs are working certainly to prepare the students to function at the entry level in the field, the students will not have difficulty per se with the exam. But we also will still be working with the publishing company to make sure that everyone knows what they're going to look like and feel like, and will have that opportunity before they're actually on the exams themselves.
Linda Harris asks, you mentioned in a previous webinar that a provider who researches by taking the computer test will be required to take the new test. From what you have said, this should take effect by March 2024, but they may see some new questions in March 2023, correct?
Yeah, so if I can make sure I'm understanding the question. So for those that recert by exam, and you set up something in there about a requirement, it's not a requirement that you have to recert by exam, that it's an option. And honestly, only about 2% of those that recertify on an annual basis, at most 3%, actually recert by exam. Most do the continuing education model. But for those that do choose to recertify by examination, the performance component items will be on those exams going forward. So the short answer is yes. Those who recertify next year, which will be March 2023, if they recert by exam, starting later this year, they may see some of those new performance items on the examination. And if they recert by March 2024, depending on when they do, they likely will see the longer examination at that time. So those who recert by examination will have those performance component items available to them on the actual exam itself.
Sean Pochik asks, will the new test design compare to the current requirements of answering a percentage of questions at the higher Bloom level or different evaluation criteria?
So we have, for our CAT exam, we will continue to administer, the CAT items, and it'll still be linear for the AEMT for a time period to be determined. So the adaptive nature as it relates to the cognitive examination portion of the examination will remain unchanged. The new performance component items initially will not be adaptive, but will be contained all within a unit, which a unit will be reviewed as viewed as a scenario. So each of the scenarios will have a set number of questions related to them, and various 8 to 10 questions perhaps per scenario that are related to the different phases of the call. They will not be adaptive in nature initially, but eventually we'd like to go towards there as we evolve with this examination process.
Chris Azevedo asks, oh, sorry, no, wrong one. Scott Vanderkool asks, will clinical judgment be integrated into the current 5 content areas, or will it have its own pass-fail?
Good question. It will be as part of the overall examination, and there will be one cut score or one passing standard for the entire examination, which includes the clinical judgment elements as well as the other domains that are currently on the examination. The feedback that would be given, though, would be related to all of the domains as well as the clinical judgment. In the event that someone is unsuccessful with the exam, we would give, here's where you compare to others in the testing cohort. So that feedback will be provided, but it will not be its own separate cut score. It'll be one score for the entire examination as a whole.
I can answer this one. Chris Azevedo asks, will a recording of this webinar be available to view later by stakeholders who could not attend? If so, any guesses on when? Yes, this recording will be available to view later, both on NREMT's YouTube page and NAEMSE's website, and it will also be sent out to all attendees on this webinar and posted online by the end of next week.
Good.
And Kathleen O'Connor asks, how will the exam reconcile the use of job aids? Preparing students to function in the field, as you referenced, would be encouraging the use of job aids when appropriate, i.e. GCS scores, APGAR scoring, medication dosing, etc.
So if I'm understanding correctly, so how will we be incorporating them on the examination? We're definitely open to entertaining different ways we can do that. I will say that recently, well, not recently, it's been a while, but we have calculators now that are available for use during the examination for drug calculations. And in some of these scenarios, they very well could end up having some of the job aids that are available to them to reference, because obviously, what we're trying to assess is their clinical judgment using the information they have. That could be one of the cues that are provided. But there's not been a lot of discussion in terms of the specifics of how we would incorporate the job aids. But I will say that with the advent of the calculator available for the examinations, that's clearly something that we're open to exploring, and where appropriate with these scenarios, that's definitely something that would be open and would be able to be introduced.
Bambi Dame asks, do you have an anticipated timeline as to when the registry intends to provide templates and scoring rubrics to support instructors in documenting minimum competencies? This will be especially of interest to those programs that will need to redesign and transition their programs.
Yeah, so the short answer is we'll have preliminary information this year. Once we continue to progress with validating, the items and the models, and then independently doing that, and then starting to pre-test some of the items so we see how they perform and how long they take to complete. So some data, there'll be information available this summer for sure. As we progress and we get more information and data back on the items, we'll continue to update the community with the updated information, including the rubrics for scoring. But I go back to the last part of your question so that we can adjust our programs to meet the exam. As I stated earlier, and I can't state it enough, if the education programs will prepare the students to function as EMS clinicians in the field, the examination itself will not be something that you have to modify your program for. So if you're able to deliver and achieve the education standards and your respective curricula, then the examination itself will not and should not be a barrier, because what we're assessing is, certainly the domains and the constructs that we talked about earlier that are just being assessed more comprehensively, a bit more objectively, and in a better way than what we do now. So there's really not an expected change from the program perspective as far as how you prepare the students for entry-level competency. If you do that, the students won't have any major challenges with the examination itself.
Paul Perry asks, I may have missed this, but with this new assessment exam, can non-KHEP graduates now be allowed to take the PMED and the AEMT exam?
What's the PNEB? I'm not.
PMED.
Oh, paramedic, I'm assuming is what you're talking about.
Paramedic, yeah.
So paramedic currently requires graduation from a KHEP accredited program or has a letter of review from COEMSP. So for paramedic, that's a requirement. For AEMT, the requirement is that they have to graduate from a state-approved AEMT course program. I'm sorry. So those prerequisite requirements haven't changed for paramedic or for AEMT.
Malcolm Robinson asks, my understanding is that NREMT has discontinued providing skill checkoff sheets for the EMT EMR level. That being the case, does NREMT still require final skills checkoffs, require that final skills checkoffs be completed at those levels in order to receive certification?
So the requirement for EMT is that they complete obviously an EMT approved program, EMT education program, as well as a state approved EMT psychomotor examination that is at the discretion of the state that can be administered at the program level, or it can be a statewide level, and that varies from state to state. So what we require is that there be a sign off as approved by the state on the skills, and that is an attestation that happens during the application process. So that's the current requirements, and it's not likely to change for the next couple years.
Leslie Huntington asks, COA is and will be the agency holding programs accountable to student minimum competencies. Who will serve as the accountability for AEMT student minimum competencies?
Another excellent question. In short, it's going to be the states, and that's why we're working with state officials right now to develop the student minimum competencies, because currently, as it stands, the state offices are required to approve EMT, EMR, and advanced EMT education programs before they can sit for national certification. This will be a part of that requirement going forward.
Does NREMT have global assessors who can help international paramedics and EMTs and AEMTs on exam preparation and coordination?
We don't have any global exam per se in terms of ambassadors or people to work with. But as I did state earlier, what can happen for folks that are trained, let's say in Australia, that want to become a U.S. medic, is they come in and work with an accredited paramedic program, and they can go through what's called an advanced placement process. And they also will be able to, upon receiving whatever information they didn't get from their Australian training, then be able to sit for our examination and be nationally certified. So that process is ongoing right now. And I will say that at, I believe it's at a CreditCon coming up, we're going to have a presentation or two on that to better demystify the advanced placement process that is in place and is allowed to happen. So that's what we have as it relates to international getting the U.S. We don't have necessarily any, I guess, any ambassadors that we or processes that we work with beyond that. But it is a pretty streamlined process to get your national certification if trained internationally.
That was the last question, unless you want to give everybody a minute, 30 seconds to get their last minute questions in.
And I'm just getting messages as it relates to the advanced placement. It's COEMSP standard Roman numeral 5A2 if you want to look for more information about advanced placement under COA's requirements.
Okay, we have a question from Kathleen O'Connor. She says, I think it's strange that NREMT is the gatekeeper for entry-level competency, but then for international applicants, they kick that responsibility to programs. So can we determine competency for international but not national students?
Well, we are. I think there's some, there perhaps is some confusion with that. So the prerequisites for sitting for a national certification, which is our exam, National Registry, is you complete for EMT, EMR, and AEMT, a state-approved program. So that has never been our responsibility to approve the education programs. And for paramedic, they have to graduate from an accredited paramedic program or one that has a letter of review. So those requirements are the same for everyone. And so all that we're doing is saying with advanced placement that if someone was trained internationally, they have to work with a program to ensure that they have all the education that is necessary as part of that program. And what we do know is that some paramedics trained, for example, in Australia, I'm making this up, but they do not receive any OBGYN training. So whenever, because midwives are very popular in Australia, so whenever they come to the US, they'll work with a program and get that OBGYN training that they did not receive in their paramedic training abroad. So they have to work with the education programs to make sure that there is an ability to put them on an equivalent level as a US trained and educated paramedic. Once they have been deemed to have met the equivalent requirements through the advanced placement process, they then come to us to have their competency measured. So there really isn't any difference at all. It's just that there are gaps in education that we know, and National Registry is not an education organization. We're purely the certification organization. So that's actually unchanged in terms of there's no difference essentially between a US trained and a internationally trained paramedic. They have to meet the equivalent education standards before they sit for our exam.
Jeff Finkbeiner asks, can you explain more about the performance component questions, such as are they independent from the CAT type questions? Are they intermixed? And how do they combine into a total pass-fail score?
So it'll all be one exam. And typically what's going to happen is let's say for a paramedic, we're anticipating they're probably going to be anywhere between 2 and 4 scenarios. Each scenario can have anywhere between 6 or 8 up to 10 or 12. So we're saying around 8 to 10 is the sweet spot items related to that. So those will be likely interspersed throughout the examination, but the adaptive items will depending on how the algorithm is going to work. And this is where, again, we'll have more information as we start to look at these later this year and see how well they perform. But exactly where they're placed in the examination and how they are introduced is, to be honest with you, to be determined. But I will say this with confidence, it is going to be one examination, and there will be a standard setting process that will determine what is the cut score or the minimal level that is acceptable for safe and effective practice as a new EMS clinician. So that cut score will be determined with use of the performance component items, as well as with the other domains that are part of the computer adaptive test right now for paramedic. So that will remain unchanged, but we will, in terms of how we determine the cut score. But we will include, though, these new performance component items as part of the cut score or standard setting process.
Ruben Ionissian asks, do you plan to release a set of items for training of the candidates?
Yes, you'll start to see some sample items later this summer. And they'll continue to be available. We're going to have a summit with EMS educators and and others in the EMS education industry, if you will, later this summer as well, and prepare the environment pretty thoroughly to see these types of questions, these scenarios-based questions, pretty repeatedly over the next few months and certainly next year in advance of the 2023-2024 launch.
And again, that's the last question we have.
All right. One thing that we also, Alan said we're going to be showing them at conferences too, which is something I forgot, which is next week or the following week is our first one, starting at the GemsCon coming up. So we'll have some, I believe, iPads and or laptops available at our booths so that folks can start to see what those items will look like, but more to come in the coming weeks and months leading up to the initial release of these and then the full launch in late 23, early 24. So if there's no other questions, unless there is one, Emily, I'll just say that, we at the National Registry value our partnership with you and as the EMS educator community. And as always, certainly feel free to reach out to us at any time. You have our contact information that we can be reached through our website at conferences. Email us. Don't hesitate to reach out to us, especially as we prepare to transition to the awesome and exciting redesigned ALS exam. And if there's any questions or concerns, don't hesitate to reach out to us, and don't assume that you know the answer. If you don't at all hesitate to ask us or to reach out to us. We're here to work together, certainly, and do our part as the nation's EMS certification organization. So thank you for all what you do in educating all the candidates, especially during these most challenging last few years. But we appreciate that partnership with you and look forward to continue that partnership going into the future.
I was just going to say, Rio, do you have any final words?
I was just going to say thank you so much to the National Registry for collaborating with us on this webinar today. We love whenever we get to work with the National Registry. And for everybody that is still here, if you're interested in obtaining CEU for this webinar today, I put the link in the chat, and there will be a Zoom follow-up email tomorrow with the link, as well as all of the resources that the registry shared with us today, as well as their contact information. So that will all come in an email tomorrow from Zoom. So I think that's everything.
All right. Thank you all.
Thank you.
Bye, everyone.
Bye.